Good morning, everyone. Thank you for joining us. I'm Dawn Genvie, and I'm a research manager in the Patient and Public Involvement team at NIHR. Welcome to the fourth in our PPI in Action webinar series. Today's presentation is focused on the structured health intervention for truckers, SHIFT, and how they embedded PPIE from program conception to implementation. Before the presentation, I'm just going to run through some general housekeeping rules. You can enable captions by clicking on the CC button. Next slide, please. And if you would like to ask a question, please click the Q&A button. You can select Send Anonymously if you don't want your name to be displayed with your question. Once you've finished, remember to click Send to submit your question. Now, without further ado, actually, just to mention as well, the slides will be sent to you after the presentation, and there's a Q&A at the end. So without further ado, I'm delighted to now hand you over to Professor Stacy Clemes.
Thank you, Dawn, and good morning, everybody. I'm delighted to be here today to provide this webinar to talk about our public involvement as part of our Structured Health Intervention for Truckers, or SHIFT programme. What I'm going to do today is just provide, first of all, just some introductory content to really set the scene and describe really why we have been working within this occupational group. So this presentation is very much going to focus on heavy goods vehicle drivers. So I'll talk a bit about the health inequalities that they experience. And then I will provide you really with an overview of what I'm going to cover in terms of our PPIE involvement. So first of all, just to really set the scene and to maybe answer questions, why are we working in this area? So our heavy goods vehicle drivers, or HGV drivers in the UK, are really regarded as an essential occupational group upon which we all rely. Certainly, the transport and logistics sector in the UK contributes about 18 billion to the UK economy and employs around 300,000 HGV drivers. However, due to the nature of their occupation, drivers have been described as working within one of the most hazardous professions in terms of health risks. As part of their job, they're exposed to many health-related risk factors, such as prolonged periods of time sitting, limited opportunities for physical activity, the kind of isolated nature of the job. Most drivers work on their own, and they're subject to quite tight delivery schedules, which can lead to quite high levels of stress and anxiety. To compound that as well, sometimes drivers are perhaps at the mercy of traffic conditions around them. So there's low levels of job control, which all can lead to poor mental health and well-being. And the final part of the occupation is the logistics transport sector is pretty much a 24/7 sector. So most drivers work shifts, which is also, obviously, we know, quite bad for health. Most drivers tend to work in the night, and hence they tend to have quite restricted and disturbed sleep. So all of these factors together really can promote unhealthy lifestyle behaviours, leading to HGV drivers having higher rates of chronic diseases, higher rates of obesity prevalence, and reduced life expectancies in comparison to other occupational groups. There's also evidence, mainly from the US, that shows that drivers with obesity are about twice as likely to have an accident as drivers of a healthy weight, which of course impacts road safety for all. So this is a bit of an overview, or a roadmap, so to speak, of my webinar today. I will begin back in 2013, which is quite scary that it's almost 12 years now since we've been working in this area. But we started this program of research in 2013, and I'll talk you through my journey and really how we've embedded extensive particularly driver involvement and industry involvement throughout this research program. So I'll begin by talking about where the idea for this work came from. I'll talk a bit about our pre-NIHR funded period where we co-created our SHIFT program with a logistics company. I'll then talk about public involvement during our grant planning. And then I'll talk about the continued involvement that we received throughout our NIHR Public Health Research funded period, which was between 2017 and 2021. And then I'll move on and talk a bit about our knowledge exchange activities, how we consulted with key industry stakeholders to disseminate the findings of the project, and move on now to talk about what we're currently doing. So for me, this road, as you see, it continues off the slide. This is a continuous journey for me. So moving on to talk about PPI involvement initially in terms of the idea for this work. Well, the idea for this work and the need for this work was actually identified by health and safety managers and personnel working within a logistics operator. And by that, I mean, back in 2013, colleagues within our school at Loughborough University were approached by a local logistics company, and the health and safety team came to us and said to us, can someone help? We're really worried about the health of our HGV drivers in our organisation. We've tried all sorts to improve their health and nothing's working. Can you help us? And that actually kickstarted this whole programme of research. And I think this is why, again, we've seen it to be really important to embed public involvement throughout, because the overall idea for this work actually came from the public. It came from people working within the logistics and transport industry. Just to kind of summarize again the poor health profile of drivers, and this is really what the company were worried about. So they could actually see in their driver population that their drivers had high levels of overweight, obesity. They were particularly concerned about this, and they were particularly concerned about the health markers that these drivers were exhibiting. The data that you can see on the right-hand side, the man with the various kind of health indicators, this is actually data, baseline data from our trial. So this is perhaps more recent data, but it is very similar to what was observed in some of our early work. And I tend to show this slide a lot now when I do knowledge dissemination events, particularly to the industry. I show this slide because within the industry, there's a lot of focus, a lot of effort, and obviously huge amounts of money has been invested in improving the quality of the vehicles, improving safety features of the vehicles. And vehicles have to have a 27-point check before they're taken out on every shift to ensure that the vehicle as such is healthy and safe to drive. But unfortunately, no such checks tend to be in place for the drivers. And as such, drivers, because of their poor health profile and their poor working conditions, they tend to feel very undervalued and unappreciated, which further can impact their mental health and well-being. But when I show this slide to industry nowadays, this tends to really make them sit and listen and take notice, and they all get the fact that, oh yeah, we seem to spend a lot on our vehicles, but we tend to overlook our drivers. And this seems to be quite a powerful message right now. Interestingly as well, when we were planning our grant back in 2015, there was an all-party parliamentary group report published, which also highlighted the concerns for our HGV driver population in the UK and actually expressed a need for the industry to do more to support the health of drivers. This was really good evidence actually that we used when we submitted our NIHR application, because again, we had further evidence here of a recognised need for this work. So I'm going to talk briefly now about some of our early phase work, which led to the development of our NIHR application. And all of this work was conducted very much in collaboration with a local logistics company to Loughborough. We're very fortunate at the time of this approach in that we just had a new PhD student start, and she was very interested in this area. So I have to give credit for all this developmental work to Veronica Varela-Mato, who completed this as part of her PhD. We also received some funding for a knowledge transfer partnership from the university to work with this company. And this enabled us to employ a postdoc as well, Nick Caddock. And the great thing about this funding was he was actually based part-time at the logistics company and part-time at Loughborough. So again, he was completely embedded within the company. He had a desk in the transport office, so he could engage quite frequently with people working in the company and with drivers to get a real good sense for some of the challenges that the drivers face to adopt healthy behaviours. He also undertook an interview study where he did ride-along interviews with 24 drivers. So he went all throughout the country and he could see, again, firsthand and experience the challenges drivers face. So all of this information together from a surveillance study conducted by Veronica, where we looked at the health profile of drivers and we looked at their health behaviours, and from Nick's experiences and a lot of our conversations with the health and safety team and drivers informally, we were able to kind of pull the challenges together and kind of co-create a potential intervention that could support drivers to adopt slightly healthier behaviours within the confines of their job. Veronica then, as part of her PhD, she tested this intervention in a pre-post pilot study with 57 drivers and undertook a process evaluation of this. And then based on the findings of this work and further conversations with drivers and the transport management team and health and safety colleagues within this organisation, we were able to refine our shift programme slightly. But the pilot study showed that it looked like it had potential for helping drivers, particularly to increase their activity levels. And this is what then prompted us to then apply for NIHR funds to evaluate shift in a formal trial. So just very briefly, I won't go into lots of detail, but what is SHIFT? So SHIFT is a multi-component, theory-driven health behaviour programme designed to promote positive changes in physical activity, diet and sitting, predominantly in HGV drivers. One of the main aspects of the intervention, and you'll see other components shortly, is a 6-hour health education session. This is a structured education session. It's very interactive, and it was derived from diabetes prevention education, which is used throughout the NHS, but tailored for drivers. And this component of the intervention was developed by our colleagues at Leicester Diabetes Centre, and the content and the tailoring for drivers is very much informed by the early work where we understood more about the challenges, barriers that drivers face. The intervention has other components as well, such as provision of equipment, so drivers can do some activities in their cab when not driving, and also a Fitbit and health coach support. So moving on now to talk about our public involvement as part of the planning of our NIHR application. So already we'd had obviously the need for the project had been identified by the industry. One activity that we did quite early on is we engaged with the Chartered Institute of Logistics and Transport, and we told them about the work we were doing. And we were very lucky there in that we had a contact who was very passionate about promoting driver health and well-being. And she was a real kind of ambassador for what we were doing and really keen to support us. And I think, again, this is an early success of the project in terms of public engagement, was being able to engage someone from this Chartered Institute who was really keen on what we were doing and really supportive. They were very keen to help us find a logistics partner for our grant application, and they wrote a piece in their newsletter highlighting about what we'd done so far and what we were looking to do. And it was really a call to organisations for who wants to take part, who wants to partner on this. And this very quickly led to an approach by DHL, who had seen the advert and they were keen to learn more. So I think, again, getting a chartered institute, a relevant chartered institute on board very early and actually having them kind of do some of your industry recruitment for you was really powerful. Of course, we had multiple meetings with our contacts at DHL. We did presentations to their senior leadership team to describe what we were hoping to do, what the benefits would be to their company that we felt, and to discuss the feasibility of actually working with them for this trial. DHL, again, very helpful with helping us with the grant planning. They provided us with company level driver data, which we were able to use then to inform our power calculation. Again, based on lots of discussions with our contacts at DHL, we did make some refinements to the shift intervention, the shift program, to ensure that what we were proposing would be feasible within a larger scale cluster trial. And one of the examples of the refinements we made is in the first study, that the very small pre-post pilot. This was, of course, delivered at one site, and that operator happened to be in the food industry. And for them, they were very happy to provide free fruit to their drivers within the transport office. And of course, this was part of the intervention. However, DHL said that they didn't think that would be feasible to be rolled out across all of their sites, because of course, not all the sites we would be using would be in the food industry. So this component of the intervention was dropped. We also made refinements to our proposed outcome measures. So all of our outcome measures were going to be conducted from the transport sites, so from drivers, ideally before or sometimes after their shift. So we had to make sure that our outcomes, again, could be feasibly conducted. Initially, we were hoping to take whole blood samples, but again, upon discussions with DHL, we quickly realised that this perhaps wouldn't be feasible, so we opted to do finger prick blood sampling instead. This is largely due to obviously the logistics of transporting bloods back to the labs at Loughborough, but also DHL said that they felt that actually doing full blood sampling put quite a few drivers off, and it could impact our kind of recruitment rates. So this was just what our funded cluster RCT looked like, this brief schematic. The shift intervention in this trial was a 6-month intervention. We started obviously with some comprehensive health assessments with all drivers across sites. We initially worked with 6 sites and undertook an internal pilot with these 6 sites. After the baseline measures had been completed, sites were randomized to either the shift arm or the usual practice control arm. The drivers in the control arm, they had the health assessment, the baseline measures, and they had quite comprehensive feedback on their health. But other than that, they didn't receive any intervention. And then we followed drivers up at 6 months post-randomization and repeated the same measures. Our primary outcome should have been at 12 months, and the primary outcome was going to be steps per day measured using an active PAL. This is a phi-1 accelerometer. However, our primary outcome measures were about to start in kind of the first few sites in March 2020. And of course, we all know, unfortunately, what happened then. So as soon as COVID hit, the study was paused. And eventually, after some discussions with our trial steering committee and with the NIHR, it was agreed that we would be better analysing our primary outcome at 6 months due to the impact of the pandemic on drivers' behaviours and their health profile. So this was a slight change. All in all, we worked with 25 transport sites. As I said, we had an internal pilot to begin with. And we had 382 drivers who were enrolled into the study. The sample were 99% male, age average 48 years, which actually reflects the demographic of HGV drivers in the country at the time. The reason we had 25 sites and not 24, which was initially planned, was in one of our pilot sites, the drivers weren't actually allowed to wear active PAL during working hours because this site delivered fuel, so drivers weren't allowed to have any electronic devices on them. So we were able to recruit an additional site in the main trial phase to make up for this. So throughout our funded period, we had continued public engagement. And one really key area that, again, our colleagues at DHL really informed was our recruitment messaging and study documentation. And when we were planning the study and describing to them our baseline measures, they kind of said, well, that's a really detailed health check. And one thing they felt was that drivers would really value this comprehensive health check. And they and us looked into what would it cost if you were going to pay privately for such a health check? And at the time, it was around about £300. So this was some of the main messaging that we used. And again, all the messaging that we used in our recruitment posters was very much informed by the transport team at DHL and what they felt would get drivers interested in the study. And I think it really worked because we massively over-recruited. Our target sample size was 336, and we recruited 382. We also spent a lot of time building trust with the drivers. We spent time in sites before recruitment just to answer any questions that drivers had about the project. And I think spending this time with the drivers initially to really reassure them that we were an independent team, we're nothing to do with the company, no data is going to be shared. We earned their trust, and I think drivers were then very keen to take part in the study. And I think this was a key aspect for us. So some just other examples of continued public involvement that we adopted throughout the trial. Initially, we piloted the health assessments, our baseline measures with independent drivers. They came to the labs at Loughborough, and we were able to get their feedback on what we were proposing to do. We also piloted our education session with some independent drivers at Loughborough. We also had a visit organised with the senior health and safety team from DHL, where we did the health checks on them, and we went through the education session with them so they could experience it firsthand, and this really helped to get their buy-in. And we had regular meetings with a PPIE group where we again would present our plans to them and get feedback. We would get their input on all of our study documentation to make sure what we were using was going to be easily understood and accessible for drivers. We also attended some of DHL's kind of wellbeing conferences, which were attended by all of their transport managers across the business and their health and safety team. And we had stands at these conferences where, again, we could speak to them, raise their awareness of the project, and kind of showcase aspects of the intervention. Just to briefly summarise the main findings, one thing we did experience in this project was quite high levels of dropout. So despite us over-recruiting, which was probably a really good thing we did lose a lot of drivers at the 6-month follow-up point. So we had 206 drivers that completed the follow-up measures at 6 months. The main reasons for drivers dropping out tended to be drivers retiring, drivers leaving the business through ill health, or drivers being on long-term sick leave. We also lost 2 sites, 2 clusters, due to the closure of the parent company. So these sites were delivery providers for Mothercare and Debenhams. But we did find, despite the smaller sample, we did find that our programme appeared to be effective in increasing drivers' activities, so relative to controls. So across all working days, relative to the control group at 6 months, the shift drivers were able to accumulate just over 1,000 more steps per day than the controls, and they also reduced their sitting time. Drivers initially actually made bigger changes on non-work days. The primary outcome was across all monitored days. We also conducted quite a comprehensive process evaluation, and in the process evaluation, there was really widespread support for the programme to be converted or translated into a driver training module, because we were very keen after this to work out, well, how can we now get this into practice? We've got this intervention, it looks positive. How can we actually try and now expand the reach of it? So after our NIHR funding finished, we were fortunate to gain funding from the Colt Foundation, an occupational health charity, for a translational piece of work where we could modify and scale up the shift programme into a driver training resource. So first of all, to inform that, we conducted a range of dissemination and knowledge exchange activities. At Loughborough University, we held quite a big public event, which was attended by lots of drivers, union representatives, senior figures from Unite the Union and driver union reps, transport managers, driver trainers, and health providers. So we had a really good relevant mix of people in the room. And in this event, we presented the findings of our trial, and we presented our ideas about that we would like to convert the shift program into a driver training module. So all HGV drivers, to maintain their licenses, they have to undertake a set number of continuous professional competency, or CPC, modules every 5 years. And CPC modules, or driver training modules, are typically delivered in seven-hour sessions. They tend to be classroom-based, and all major logistics operators tend to offer their own training. They're accredited training providers. So one of our goals was to see if we could work with a logistics operator to convert the shift program, particularly the 6-hour education session, into a driver CPC module. At our initial knowledge exchange kind of consultation event, we did ask kind of the audience in the room, would they be supportive of shift being turned into a driver CPC module, and 100% said yes. We also gained their feedback and their thoughts on what aspects do they feel are most important to cover in the module, in addition to what we were doing already, and is there anything else that we were missing? Again, one big success of that knowledge exchange event was there was a senior health and safety director from Wincanton in attendance, and he really liked what he saw from the presentation, and he saw huge merit in shift. And straight away after that event, he came to us and said, we want shift for our business. So that really then kick-started a new partnership for us with Wincanton, where over the last 2 years now, we've worked very closely with them to convert and co-create the shift program into a driver training module. But just briefly, some other dissemination activities we do, and these are very much ongoing. When we first finished the project, we did provide a presentation to our colleagues at DHL of what we found, and we also discussed with them and got their input on the next steps, particularly around a driver training module. I've also been invited to join a national expert working group. This is an industry-led group on driver health, where again I can have quite a big say on pushing the agenda forward in this country for driver health promotion. And we've done a number of invited presentations at kind of key industry-related conferences. Again, another kind of perhaps big success in terms of the public engagement was our relationship with Unite the Union. So we have developed a really strong relationship with Unite. And again, we got in touch with one of their senior figures quite early on in the project and told him about what we were doing. And he's now since been extremely supportive. But again, gaining their trust took quite a long time, because again, we had to show them that our interests were very much on driver health promotion. We're independent for any operator. What we want to do is get drivers healthier. And he really gets what we're doing. And as such, now he's invited me to present our work over the last 2 years at their conferences with drivers. The picture on the bottom right was taken last June of the group photo, and he said that he wants me back each year, which is lovely. And again, it's a great opportunity to speak informally to these union reps, get their feedback on what we're doing. But crucially, because the union are really behind what we do, they really back us. And the senior leader there tells the drivers, you've got to get involved in this research because they're trying to help you. So having that buy-in is really key. So just briefly, what we've been doing, obviously, since the grant finished, we have worked very closely with predominantly Wincanton driver trainers and drivers and their senior management. And we've undertaken a series of co-creation workshops where we have looked at the content of our shift education session. We've looked at feedback from our trial, and we have now tweaked the content. We've co-created with these drivers and driver trainers a shift CPC module. One interesting thing that came out of this co-creation work was also the creation now of a new shorter bite-sized version of the shift program. And this is a 1 hour session called short shift. And this was because the industry told us that they haven't got scope to do a full compulsory 7-hour CPC module on shift, as much as they'd like to, but they do have other things they have to cover with their drivers in their mandatory training. But they said to us, if we can create a bite-sized version to raise awareness of health, then they can embed that into their mandatory training. And that's really how short shift was developed. And again, this is an industry-led idea. So again, with Wincanton, we work very closely with the training team, and we were able to get our 7-hour shift CPC module and the module component accredited by the DVSA in September 2023. And then we've since obviously worked very closely with Wincanton to actually implement this program within their business. So to facilitate this, 65 Wincanton driver trainers have been trained to deliver short shift as part of their compulsory training module that they rolled out from October 23. So again, hopefully a real good success. And what's great to see is that this is being put into practice now. So Wincanton incorporated short shift into their mandatory driver training module for their 23-24 training cycle. So to date, all 6,500 Wincanton drivers have experienced the short shift session. Short shift is very much designed then to raise drivers' awareness and to signpost them to the 7-hour shift module, which Wincanton have offered to all of their drivers as an optional module that they can do in company time. And there's 7 driver trainers trained to deliver this. Wincanton are now rolling out a full 7-hour shift session once a month, and they are marketing it quite heavily throughout their business. So we are monitoring feedback. We're doing a longer term follow-up of this implementation. And I'm just going to share with you some of the quotes that we've had on our feedback forms from drivers after they've done the short shift session. Drivers particularly like the style of the delivery, the fact it's very interactive, it's very different to their regular driver training. Okay, this really brings me to a close, and I just wanted to kind of finish really with some of the key lessons that I've learned in terms of working with kind of the public on this project. And I think one of the big take-home messages I would say is the key thing to successful PPIE is really building trust with your group. So with your kind of colleagues, your industry colleagues in this case, and building trust really takes a long time. So we have known our contact at Unite the Union now for probably almost 10 years. And we've got this great relationship now. We've obviously been working with Wincanton quite closely for 2 years, and we've got a great working relationship with them. But certainly listening to your partners, building trust is one of the most important things, but it does take time. So I would always suggest that people allow sufficient time to do this. And again, really just building these long-term relationships. And certainly in our case, working with the drivers as well, building their trust is absolutely key. Because again, with drivers, when you talk about health, they worry that, well, if I'm unhealthy, I might lose my license, I lose my livelihood. So we again spent an awful lot of time with the drivers to really reassure them that we're completely independent of their company. No data will be shared. And this is just part of a research project. And what we find that works really well when we do any work now with the driver population is our research teams go in our full branded Loughborough kit, just to really, again, emphasize that we're completely independent of the employer. Again, listening to your kind of PPI members and acting on their feedback and then demonstrating to them that you've acted on their feedback gives them faith in you and gives them, the sensation, the knowledge that they are being listened to and they are having a real impact on your research. And just being accessible as well to speak to people when they want to speak to you is really powerful. And again, accessibility of documentation, ensuring your documentation is understandable, readable by kind of all public members. So those are some of my take-home messages, kind of key recommendations really for working in this space going forwards. So what about the road ahead for us? Where next on our journey? Well, there's an awful lot that needs to be done still to support the health of drivers. So we're going to be quite busy for many years to come, hopefully, in this area. We currently have some projects ongoing at the moment, really off the back of the SHIFT trial, looking at medical check provisions for professional drivers. We are now working, hopefully, with other organisations who are very keen to adopt SHIFT. We've got a great relationship as well now with National Highways, who seem to be really advocating for SHIFT, and they're actually quite keen to adopt it within their business as well for their traffic officers. So we'll be working with them to now modify the programme for other driving groups. We're also working with some bus companies who are quite interested in it. We want to continue as well promoting it within the HGV population. And again, with our Wincanton colleagues, we're going to be really lobbying the DVSA to try and make SHIFT a nationally recognisable module that all drivers have to do. And that really draws my presentation to a close. So I would just say thank you very much for listening. I'm just going to leave you with some nice quotes from some of our RCT participants on this slide, but then shortly I will hand back to Dawn, who will chair the Q&A. But if anyone would like to know more about the project or chat to me in more detail about the trial, because running this trial in this hard to reach population was extremely challenging, and I could do a whole separate session on the challenges that we face from more of a research perspective. So if you'd like more information or would like to know more about it, then please do get in touch. And finally, I would just like to acknowledge all of our partners on this work.
Thank you, Stacey. That was a fantastic presentation, really informative walk through how you embedded PPI throughout your project. So thank you very much. We have got some questions in the Q&A. So the first one is, were participants excited and motivated to take part in this? Had any of them done similar things before, and would they take part in research again in the future? Was it easy to build trust?
Mm-hmm. Yes, it did take a lot of time to build trust. And one big thing we did, again, informed by our contacts at DHL, is we called them lobby days. So this was before recruitment, and we would actually have members of the research team go and just spend time in the depot with some of our SHIFT posters and some of our props that we were going to use in the intervention. And again, the team were very much branded in Loughborough gear. And they just spent like days there just chatting to drivers and showing them the information sheets and explaining to them what the project was about. So I think initially the drivers, when they first heard about it, they were very apprehensive about the project and probably not willing to take part. But through spending time in sites and enabling them to chat to the research team and completely understanding them from the team that we're completely independent and no data would be shared, the drivers became on board. And I think once we got that trust, then we had a lot of excitement in the project. And I think the fact we over-recruited showed that drivers were actually very keen on doing something to improve their health. To answer the first part of the question, I don't really recall any drivers saying that they'd done anything like this before. So again, I think for them to have some kind of provision of a health program available to them was completely new, and they were really, really keen to take part.
Fantastic, thank you. And sort of following on from that, we've had a question asking, how did you develop the relationships? And they've gone on to ask about building trust, but you've just answered that. So how did you develop the relationships with the drivers involved in the research?
It was just having time to speak to them. And again, just really initially through these initial lobby days, spending time on site and just chatting to the drivers. So quite often drivers will turn up quite early to get their keys before their driving shift. And drivers, they do seem to be quite willing to chat, which is great. They are very chatty, probably because of the isolated nature of their job. So once you get chatting to them, they are really, really chatty. So I think that was really important. It was just to chat to them, just spend time chatting to them and give them time as well. Quite often when you speak to drivers, then sometimes they completely start to offload on you about all the challenges that they face, understandably. So the fact that we were just really kind of showing kind of empathy, just listening to them. I've noticed that a lot in all the work we've been doing, just actually spending time to listen to them, listen to their story, and be kind of sympathetic to them, I think gives them a lot of reassurance that, oh, actually, you're here to support them. And that was absolutely key, I think, in building the relationships and building trust.
Excellent, thank you. Did you have to adapt to ensure EDI within PPI, for example, translations and minority groups? And how did you ensure inclusivity or EDI?
That's a really good question. We didn't do too much adaptation on the EDI side when we were doing this grant. This is one, I guess, one reason for that is the sector, the driver population in the UK, and nearly everyone working in transport and logistics is very heavily biased to a white male group. So most of our participants, certainly, and most of the people that we were liaising with, they were all kind of white, mid-aged men. So unfortunately, we didn't have much diversity in our sample. We did try and recruit females, but there's just not that many female drivers. And again, this is something we're trying to do in more of our research, is we're trying to make sure the sample is diverse. But it very much reflects at the moment the demographic of this population.
Yeah, absolutely. I mean, that leads on to the next question. I'm wondering about the gender split in terms of whether any of the study participants were female, and if you have any data on whether the same health issues apply to female HGV drivers.
Good question again. We had a very small sample of females. Obviously, we didn't want to exclude females. I think in our sample, we had about 5 that took part. So 5 out of 382. Again, it's really hard to tell on an N of 5, but these females did exhibit, kind of looks like they exhibit very similar risk factors, very similar health profiles to the male drivers. We did really kind of try it and we were successful in doing this, a female lady driver who actually was more of a independent driver, and we actually piloted our intervention on her. So she came to Loughborough and we ran through the education session with her, which was great to be able to have a female involved like that. And again, we got some good feedback from her, but there was nothing separate and nothing different she wanted. She, explained exactly the same barriers, challenges that she faces to the male drivers.
Yeah. Was there resistance from employers due to effect on profitability, for example, fewer driver hours, more overtime pay, etc.?
I think we were very lucky in that DHL when they heard about the project, they were very keen to partner with us, because I think they could see the long-term benefit, and I think they also could see that their drivers' health was, really in need of looking at. So again, they could see that perhaps, okay, by releasing their drivers to take part in our study, so it did obviously cost them a fair bit of money to their business, because they had to replace their drivers with agency drivers, particularly when our intervention drivers were doing the 6-hour education session. This blocked them out for a whole day, typically. So it did cost DHL a fair amount, but I think they could see the potential longer term benefits. If they invest in this, then it could improve their drivers' health, and hence this could lead to healthier drivers over the long term, with then fewer sick days, less drivers retiring early due to poor ill health. So they seem very receptive with it, and Wincanton, I have to say, have been exactly the same as well, because I think they can see the potential long-term benefits.
Yeah, that makes sense, doesn't it? Did you form your PPIE group specifically for this study, or had you a group already involved in other studies? Where did you recruit PPIE members from?
Yes, so the group was very much formed for this specific study. We didn't kind of have this group for previous works. I guess really we just started working in this area, and we recruited our PPIE group largely actually through word of mouth and through some of our contacts, and through kind of people actually approaching us when they heard about the project as well. So one example, we actually had, again, an independent driver who was a real great member of our PPIE group. And he'd heard about our research just through friends of friends, and he approached us and wanted to get involved. So, and he was great because he had quite a big following on his Facebook page. And he was really vocal for, again, highlighting all the challenges that drivers face within their occupation. So to have him on board was great. And then through kind of contacts and through people we knew, we were able to recruit more of a transport manager to a PPIE group. We did also have the lady from the CILT that was a big kind of advocate of the project as part of the group. She unfortunately retired during the grant, so we lost her. But it was very much a group that was recruited largely through word of mouth, but also supported by the NIHR Leicester Biomedical Research Centre that I'm part of. And obviously there's a huge PPI group and a PPI lead there. So we actually drew on her expertise to help us recruit. So she would put adverts out into the community, talking about the research and asking if people would like to get involved.
Excellent, thank you. How did you build research literacy in a group that might not have been exposed to research before, given they're a hard to reach, seldom included group?
Again, I think a large part of that was spending kind of the initial contact time in the sites, and spending the time to discuss with the drivers about the research project. And we had, again, our participant information sheets were created in a very kind of driver-friendly manner, with kind of lots of graphics and very much in an accessible style. But again, what we would do is members of the team would discuss with drivers about, well, what is this randomized controlled trial? What does it mean? And they would kind of discuss it in kind of hopefully more publicly accessible terminology, what we were doing. So most of the research literacy really came again from these early discussions at the recruitment stage, but also during kind of the health measures. The drivers would spend about 2 hours with our researchers as part of our baseline and follow-up measures. So they would have lots of conversations then about what was going to happen to this data, what we were going to do with it. We also used a text messaging service that we kept in contact with drivers throughout the trial, and we would use that for the intervention arm to help with some step count challenges, but we would also use that as a way of contacting the drivers and reminding them of their follow-up health measures. And again, that was a great way for some drivers would ask us lots of questions on that all the time. Others would just respond and confirm they'd be at their assessment. But I think just regular contact with the drivers, again, having just the time available to chat to them and answer their questions was helpful in building their research literacy.
Yeah, thank you. Next question. Are there any plans on how you will integrate this within smaller haulage firms? Time and costs are a bigger barrier for them than larger organisations. They're especially hard to buy into initiatives like this.
Definitely no, I think that's certainly going to be a challenge. I mean, what we would like to do that would hopefully then increase the reach of Shift, particularly into kind of these smaller firms, is if we can lobby for the Shift module to be kind of really seen as a compulsory CPC module by the DVSA, then of course all drivers will have to do the module. So for people working in smaller firms, where perhaps the firms themselves don't provide the training, they outsource it to other companies, then that's a way that the drivers could then experience the Shift program as part of mandatory training, provided by a third party, but within kind of their regular working hours still, because of course they still have to do these 35 hours worth of training over 5 years to maintain their licenses.
Yeah. Were any of the PPI members involved in knowledge translation activities?
I guess in a way, perhaps some informal activities they were involved in. So, for example, the driver within our PPI group, who again had quite a big following, he was quite helpful in just disseminating kind of bite-sized messages from the study, particularly on his Facebook group and to his followers. So he helped a lot in that respect in terms of disseminating it. And then working again quite closely with our contact at Unite the Union, he was really instrumental in encouraging drivers and union reps to actually come along to our dissemination activity, particularly our workshop that we did at Loughborough. Apparently he told some drivers, that they have to go to this, and they told their employer that they've been told by the union they have to go, and the employer gave them the time off to come. So that was great. And then I think really the union do seem really keen to keep promoting and supporting what we do. So the fact they invite us, it seems now annually, to present at their conferences, and they actually give us a bit of a topic. They say, well, tell us any updates on shift or anything you're doing now. I think the fact that they're inviting us continuously is a great opportunity, again, to be able to disseminate the work to drivers. And hopefully sometimes now these driver union reps will go back to their employers to say, I've just heard about this, I think we should do this, which is hopefully, again, how it's going to snowball.
Absolutely. Somebody has asked, what did the blood test show?
Good question. So the blood test, the finger prick blood samples, we analyze them for HbA1c, so glucose control, and kind of triglycerides. Again, with the HbA1c values, they were, the proportion of people with elevated HbA1c wasn't actually too high in this sample. It was quite comparable to the general population. But this probably is likely due to the fact that obviously diabetes, perhaps uncontrolled, is a licensed disqualifying condition. So the fact that our sample were actually exhibited quite good levels of HbA1c is probably reflective of the fact that they are working. In terms of cholesterol, I can't remember the values off the top of my head, but I think overall the individuals with high cholesterol levels, that proportion was quite high and higher than what we did see in the general population.
Thank you. Did you use any innovative or novel approaches to run your PPIE meetings that you can share? For example, ways to increase engagement or involvement in the meeting discussions?
We organise, I know certainly one of the earlier meetings, we tended to organise perhaps more in the evenings to, again, make sure that they were accessible so people would come to them after work. So evening meetings, and obviously offering some food as well and drink, which was absolutely key. And we've done that, again, at all of our co-creation workshops we've done since, again, always provide lunch for participants. And I think really in the PPIE sessions, offering as well kind of some health checks. So I think most times we would have our health check kit with us, our portable kit. So we could say to them, if you want to come and have a go and have your body composition measured, your blood pressure, we can do that while you're here. And in some of the meetings as well, we actually ran through just not the whole shift education session, but just activities in the education session. So again, they could experience it firsthand. And I think that really boosted engagement as well. And it created a lot of dialogue in the meeting. And we found we do that a lot now. We tend to go to industry events and we tend to have shift stands, which is great. And in every event we go to, we take our blood pressure monitors, our stadiometers, our body composition scales, and some of the resources and tools that we use in the program. So the shift education session, as I mentioned, it is very interactive and there's lots of group discussions, lots of activities. One game we play in that is called the calorie game, and we've got different foods, models of different foods, and we ask drivers to order these foods in calorie order from the highest to the lowest. And that game goes down really well. So we tend to take that to everywhere we go now, and we play that with the audience. And I won't tell you the answer in case we play it with you any times.
Sounds interesting. So looking back at the PPI you've undertaken, is there anything that you would add or change?
That's a really good question. There's probably always, I say, the more people you can engage with and the more contacts you can have, the better. I would say probably if we could have expanded our PPI group or expanded our contacts much earlier on in the grant, that would have been really good. But I guess some of these things, they take time and things snowball. And now we've got a great kind of contact list of real key stakeholders working in the area. The people that we really want to target to make a big change. I feel we're there now, but it's taken probably 12 years to get there. But I guess part of it is just it's building the reputation, getting the research out there, and it does tend to snowball. So I been invited to talk at quite a few different industry events now, and then normally from speaking at one event, someone will then invite you to come to something else, and then more opportunities arise. So there is this snowballing, but I think I'm quite I feel that our PPI has been quite successful. I certainly feel the relationship we've got with the unions who are really advocating our work is a major win for us, and the good relationships we've got with the companies, I think, has been a really good success story as well.
Absolutely. Somebody has said a fantastic project showing a clear example of how to embed PPIE throughout a project. I wanted to know if you're planning to work with providers of service stations to explore things such as the provision of green space for walks and increasing food choices, which currently always seem to be focused on ultra-processed, low nutritional value, high calorific foods.
Definitely, this is really my next big thing that I want to work on. And I guess this is the thing with all of these big projects like this. When we finished the RCT, my head was left spinning. I had so many more questions and answers. You think you do the big trial and you solve your questions, but no, you don't. You end up with way more questions. And I think chatting to drivers over the years about kind of the diet, that's one thing that came up a lot in the process evaluation and subsequent work, is for drivers to have a healthy diet. That's a real big challenge. And I think a lot of that comes down to their environment. And you just have to look, as I said, at the foods available at truck stops, in particular service stations. They are ultra processed, really unhealthy. So this is something we want to look at. I've now got a great relationship with people from National Highways, and actually they're investing a lot of money on improving service stations and rest stops for drivers. And we're trying to get in on that and work actually closely with them. But we have, since one of my PhD students who's recently finished, she's just published a paper, actually an interview paper with drivers all about the dietary environments, and we're going to hopefully use that as leverage to gain momentum in this area. But we also have a collaboration with Stanford University in the US planned, where we're going to use an environmental audit tool that they've developed, which is a geolocation tool and enables photographs. And we're about to start a project this year with drivers, and hopefully I'm going to recruit them via the unions to actually, for drivers to go and audit the environments and document evidence. And I feel that that would provide us with really good, powerful evidence to take back to National Highways and key policymakers to lobby for a change. So yeah, absolutely, this is the next big thing for us.
Brilliant. So somebody's asked about funding. After the RCT finish, you mentioned some funding from an occupational health organisation. How did you fund all the more recent work with the CPC module development?
That's a great question. That was actually all funded by the Colt Foundation. So with the Colt Foundation, we had it was about a 2.5-year project grant. It literally finishes on Friday this week. That's when our funded period finishes. But through that grant, that funded a postdoc, and it funded the time of our colleagues at the Leicester Diabetes Centre, because of course their input has been really key, because again, they oversee the curriculum of the shift session and short shift. So the Colt Foundation grant has funded what we've been doing so far on the co-creation work and the initial evaluation. We fortunately now do have a PhD student that's just started her PhD. She's funded through the university and through the Leicester Biomedical Research Centre. And some of her PhD work will then continue on this longer term evaluation of the implementation within Wincanton. But what we will be doing now is really trying to market the SHIFT program to different organisations, and hoping that other organisations take it on. If they do, then the way it's set up now is there'll be a licence fee. It's quite small, it's obviously not for profit, but that goes predominantly to our colleagues at the Leicester Diabetes Centre, who are NHS staff, the education team, and obviously that pays for their time. So that's how hopefully kind of the project will continue.
Thank you. Somebody has asked, what was the best way to disseminate your findings to people in a way that was relevant to them? How was that informed by your PPIE group?
I think, again, doing these kind of more like knowledge exchange workshops was really valuable. So again, the suggestion, again, from public members really came that, oh, we could hold something we were thinking about, and then they agreed with us. It'd be great to hold an event at Loughborough, very much targeted at drivers, people working within the industry, and doing a presentation on the programme and our future plans. So running initially that consultation event was really beneficial. So I think holding some dissemination activities was really good. The other thing we did do actually was we produced a kind of a basic infographic as well on the main findings of the trial. And we got some drivers and managers just to take a look at it and see what they thought. And we've used that as well. So we sent that to DHL and we asked them to send it to all the transport sites that had participated. So we just had a nice, again, infographic way in which the drivers that took part could actually then see the findings. And that infographic, again, has been quite useful to be shared with different industry partners, so they can just see a quick snapshot of what did the programme show.
Yeah, brilliant. Thank you. Apologies if I've missed this. How were PPI members identified and recruited? Also wondered whether there was any criteria for them to meet, i.e. research, PPIE experience and diversity.
So again, they were recruited largely through kind of word of mouth and through kind of hearing about the study. And we put kind of, again, some adverts out via our PPI lead at the NIHR Leicester Biomedical Research Centre. But yeah, a lot of it was people that actually also found out about the study. They found out what we were doing and they were quite keen to get involved. We did have some in-person group PPI meetings early on in the study where, again, we invited people to Loughborough so everyone could meet. And again, the research team, most of the team were there as well. So there was a good integration between the PPI members and members of the research team. Unfortunately, because of course COVID hit towards the end of the project, more ongoing kind of PPI activities tended to be online.
Yeah, thank you. Do you know if the drivers have gone on to do any more PPIE since being involved with your research?
Good question. I'm really not sure, actually. I don't know. I don't think they have, purely because I think we're the only ones doing research pretty much in this area at the moment. So I'm not aware that they have gone on to be more involved, but yeah, I don't know for sure.
Yes. Did you pay members of the PPIE workshops? Also, was this a consistent group or did the groups change as the project evolved?
We didn't really pay them. At the time, we didn't have any budget to pay them. I think this was when we did the application. PPIE has come on a lot more since when we wrote the application. It's obviously a lot more structured and it's a bigger part of applications now. We had a small PPIE budget in our grant, but that we used really to actually cover travel costs for people to come to Loughborough, to come to meetings, and obviously for refreshments, but there wasn't a payment as such.
Okay, thank you. Somebody said this is a really innovative project through NIHR. Have you any data on racial mix among the driver communities? And then the next question following that is, what about characteristics other than gender, ethnicity and age? For example, learning disabilities may be important here. Also, what are the implications of digital exclusion for rolling out the intervention, etc.?
Good question. In terms of other characteristics, we did record ethnicity. I can't remember exactly off the top of my head, but we do have the breakdown of the different ethnic groups in our main outcomes paper. It was predominantly kind of white males, but as a guess, I want to say we had about 85–90% were white males, and then kind of a small ethnic mix. Those were kind of the main characteristics we looked at in the trial, was more about obviously the sex, age, ethnicity. We didn't, in this trial, we didn't actually record if anyone had a learning disability or not. But actually since then, more recently, I have taken part in an event with National Highways, actually all on neurodiversities and actually how health messaging can be tailored for people with different learning disabilities and different kind of neurodiversities. So this is something that's really big on the agenda of National Highways at the moment. And it looks like we hopefully will have the opportunity to feed in on that. But again, we feel that shift, because it's very interactive and it's very discussion based and it is in person predominantly, we get a sense, and this is some of the feedback we've had as well from drivers with neurodiversity that I spoke to at this National Highways event. They feel that the programme actually would be quite well suited to different groups, because again, it's very interactive. There isn't much written material either. It's very much kind of learning through group discussions and through experiences and sharing of experiences, which perhaps makes it a bit more accessible to drivers perhaps with dyslexia, for example.
Yeah, absolutely. So the next one is fantastic presentation, so valid. It's terrific that the shift programme targets truckers. Two issues. What approach is taken when the company's schedulers who plan the shifts and journeys focusing on getting goods delivered on time without considering the well-being of the driver, particularly the trampers night shift drivers who may not access toilet, showers, hot drinks or food because of the drive time schedules. I've had calls recently to listen to HGV trampers who feel worthless and who are constantly tired and anxious about their lack of sleep and access to rest, food, showers on their runs. The companies don't seem to consider this, and if raised, it is met with, there are plenty of other drivers who can manage this. So that's number one. And then two, there is no national infrastructure that caters for truckers. They have to use the same services as the general public. No separate facilities with homemade healthy food, comfortable chairs, treadmills, weights, clean showers. And they sit in their cabs for hours, often in isolation.
Yeah, I completely agree with all of those challenges, and certainly this kind of goes into our future area of research, really, in that we are really keen now to try and do more to support the working environment of drivers, and this is where we're hoping to partner for some new research and new collaborations with National Highways, because right now they are trying to improve rest stops, to make rest stops more safe, to provide more green space, facilities for exercise, improving kind of the dietary provision. So this is something that is on their agenda, but we want to get involved in that, because what we would like to do is to actually work with the drivers and get the drivers to do some audits of some of the poor facilities, to really show these kind of senior people what actually they have to deal with, to really further advocate for change and more funding for this. But we really want to, kind of get the drivers involved as well, just to make sure that perhaps what National Highways are doing is actually what the drivers want, because we don't want them to go and invest all this money and find then that actually what they put in place isn't appropriate for the drivers. So we're kind of pushing for us to get involved, and for then us to involve drivers in this. But everything you said about the trampers, completely right. It's such a challenging profession. It's such a challenging situation to work in, and it's really hard. And certainly the scheduling is really difficult as well, because the organisation want to try and maximise profits and maximise schedules for delivery, and quite often the driver is seen as perhaps the least important part, whereas arguably they should be the most important part. And I think until there's changes in policy on drivers' working hours as well, it's going to be really hard to change things. But again, through this expert working group that I'm involved in as well, these are the types of things that we'll be pushing, as well as trying to really lobby for policy change to improve the overall working situation for drivers.
Excellent, thank you. There's just a few more questions. So what do you do if you identify people at events who have significant problems with their measurements, for example, really high blood pressure? How do you manage that responsibility?
Yeah, that's a good question. And that's something obviously we really were conscious of. So what we did in that respect is we had a standardized referral letter. So if we did measure someone with, say, very high blood pressure, we'd obviously repeat the readings a number of times. And if they looked like true values, we would write the readings down, and we would give this referral letter to the driver. And we would say to them, your values are quite high, or if it came from the blood tests, we would say obviously they look to be high, but we are not medics, we're not diagnosing any conditions, but we would recommend that you see your GP for further checks, and we would provide the driver with a letter and recommend that they take them to their GP. But that's all we did. We obviously, unfortunately, can't mandate them to see their GP. And obviously, we certainly didn't share that information with the employer because, of course, that would go against our ethics and obviously breaking trust. So it was really a recommendation from us to say to them, you know, we strongly recommend you get this checked.
Yeah, absolutely. And last question, I don't feel I've quite understood how PPI contributed to the planning stage and application and then to the management of the project. Can you say a little more about that, please?
Yeah, I think in terms of planning stage, what we did, we worked very closely with the our industry contacts at DHL. So they were our main kind of, I guess, PPI group, informal group at the time, where we were to kind of sit down with them and we would present our ideas for, say, these are the measurements we'd like to do. This is what the intervention looks like, and then we would get their feedback on it. And of course, some things they would say, oh, I don't think that's feasible, such as the fruit provision. So therefore, we changed that. We removed that from the intervention, and also the outcome measures as well. Because there's a big team of us on the grant, we had quite a few outcome measures, and obviously we wanted more as well. But again, we're speaking to the transport managers, you know, they said, well, we can only give you the drivers for, you know, no more than 2 hours. So do what you can in that time. So that's really how we work with DHL in this case to plan the grant and to plan the study. And then in terms of the overall kind of management of the trial, we had our independent trial steering committee, and that included 2 kind of public members, a driver, an independent driver, and a transport manager from a different organisation. So we had 2 public members that played a key role in the trial steering committee.
Excellent. Thank you, Stacey. That's the end of the Q&A.
Thank you.
Thank you. Thank you for some really fantastic questions there from everybody as well. So next slide, please. So thank you again, Stacey, for a brilliant presentation. It was really informative, really, really helpful, hopefully, to everybody who's attended today. I just wanted to signpost everybody to some upcoming events. So we've got another webinar on the 21st of March, 11 till 12, and then another one on the 14th of May, 1 till 2. And after this presentation today, you'll receive an email with an evaluation form for today's webinar. We'd really appreciate it if you can complete that, because it will help us to shape future webinars. Thank you very much, everybody.